A very warm welcome back to India Global Forum, and as promised just before the break, we're now going to spread our wings and travel to Africa, to West Africa in particular, because we promise you that this is an absolutely global event. And so now I'd like to take in the perspective from parts of the continent and look not only at how it's been affected by the COVID pandemic, but also get a perspective from there on how economies around the world can grow out of this crisis and harness some of the opportunities that may come our way. And I'm delighted to welcome the Foreign Affairs Minister of the Gambia to the India Global Forum. That's Dr. Mamadou Tangara. Dr. Mamadou, welcome. It's lovely to have you with us. And I think first of all, it'd be quite useful for us to know how the COVID pandemic is playing out where you are and what is currently the state of play, because I know, for example, just in the last couple of weeks, a warning that you are running out of the AstraZeneca vaccine.
Thank you very much. It's a pleasure to join this forum. It's a great honor. And I want to share what is happening here in the Gambia. When COVID struck the world, we were all worried. And panic was gripping each and every one of us. But then we knew that when you are faced with challenges and you need resources to deal with the challenges and you don't have the means to deal with them, you have to practice the policy of your means where you don't have the means of your policy. And that's how government decided to take some very strong measures by cutting on all the travels. Of course, then you cannot travel, but with the money we were able to save, we procure ambulances, we procure drugs. And right now, we were lucky to receive some dose of Sinopharm vaccine from Senegal. That was a donation by the President of Senegal, President Macky Sall, who gave to his brother, President Adama Barrow, 10,000 doses. And later on, we had the AstraZeneca. Then the challenges were to convince people to go and take the vaccine. And at some point, some people were reluctant to take it, thinking that maybe the climate is playing in our favor. But then a massive sensitization campaign took place and people started taking the vaccine. And now that we need to take the second dose, we are running out of vaccine. So now there are people who are coming, but priority is given to those who took the first dose. And as of now, we are in that situation and we are still looking to get the second dose from some of our partner countries to see how best they can help us deal with this situation.
Yeah, sorry to interrupt. I just wanted to pick you up on some of those issues you raised. So many interesting points, not least that access to the vaccine. Do you feel you have adequate supply, or that adequate supply will be forthcoming, given that, as you've touched on there, you've run out of the AstraZeneca?
No, quite honestly, we don't have adequate supply at the moment, and that's why we, through the European Union, we have a colleague who is working there who told us that Estonia, I think, have a surplus of vaccine, AstraZeneca, that they're doing using. So we are trying to see how best they can help us. And I think this forum is a wonderful opportunity to appeal to others if they have extra vaccines that they can share with the Gambia. Will be more than grateful, because this pandemic has proven to all of us that the world is a global village. Whatever affects one directly affects all of us. I will not even say indirectly, but all of us directly. I think this is a situation where we all have to buckle up and work together and see how best we deal with this situation.
Yeah, and it's certainly, as we were hearing in a panel a little earlier, until the whole world has access to the vaccine, that this problem does not go away. And how frustrating, therefore, when you look at the availability of vaccines in certain countries, that there is not an equal distribution, particularly affecting where you are.
Well, it's, I was listening to one of the European Union leaders who was saying that nous ne voulons pas être les idiots utiles. We don't want to be the useful idiots by giving out vaccines. But today, this is not about Europe, because this is a virus that does not know borders. It will go beyond borders. And it's really very frustrating to know that some countries have extra and there are others who do not have. I think this is more than ever before that global solidarity must be the motto of and the order of the day. We have to help each other. We don't even have a chance.
And so what are the practical implications day to day? You said there's many people who've had the first vaccine who cannot now get the second dose. What does that mean in terms of reopening the economy there? And of course, for the people who've not yet even had the first dose.
Well, the implication is that, well, we are grateful to God Almighty as a believer that we don't have those cases. I don't know what is playing in our favor, but as of now, we don't have, I don't think we even have 30 people in serious critical conditions. But we need to be vigilant, because if we rest on our laurels thinking that this virus is gone, we are just fooling ourselves. And that's why the campaign, the Ministry of Health is engaged in a vigorous campaign to invite people to come for their second dose, and we are also get other doses to help those who have not been vaccinated. And today people are coming now, we don't even need to convince them to come. At first, they thought that no, this will not happen to us. But now that they are seeing that it's happening, and each family here has lost at least a loved one. So people are more and more conscious of the fact that they definitely need to come.
And you touched on vaccine hesitancy a little earlier, but just give me a sense of, whether that message is getting through and what uptake, provided you have adequate supplies, what uptake is looking like there.
Well, I'm sure now that people are sensitized more than ever before. If we have more vaccine, you have people queuing coming for the vaccine. At first, it was expatriates, the European tourists who were here who were going for it. And then at some point, someone called me. He said, well, our people are not coming. Are we supposed to give it only to expatriates? Because these vaccines are meant for Gambians. I said, well, this is not about the Gambian or non-Gambian, because the virus does not distinguish about the nationality. Let's give it to those who are coming. Maybe that will encourage our own people to come. Because, there are all these conspiracy theories about AstraZeneca and all the vaccines, but at the end of the day, we know that if there are more advantages in taking the vaccine than not taking.
I know there is a lot for us to discuss as far as the pandemic is concerned, but I'm aware also I want to talk about some of the opportunities and some of the growth that we would hope comes out of this. I know you are just back from Saudi Arabia, for example, even the last 24 hours just landing back on a trade mission, amongst other things. I wonder, give us a sense of what that focus will be as far as Saudi Arabia is concerned, but then also describe to me, if you can, the links with India and what role India plays in development growth opportunities for the Gambia.
Well, I will start with our trip from Saudi Arabia. It was an excellent trip, an opportunity for us to strengthen our bilateral relations with Saudi Arabia. The Saudi fund has been very helpful. They started helping the Gambia since 1978, if my memory serves me well. And they've been intervening in many areas in infrastructural development, roads construction, and as one of the great leaders of India will say, let's build a road and the road will connect us. That's Mahatma Gandhi. India, of course, is one of our strongest partners. And during this situation of pandemic, India is among one of the few countries that helped the Gambia in very difficult, and they know they need it in India, but based on solidarity, international solidarity, India helped Gambia. The COVAX roll out its thanks to India. And apart from that, at a bilateral level, India provided a lot of medication to the Gambia. On the trade and other human resources capacity building also, India has been very, very supportive of the Gambia. And I want to seize this opportunity to thank most profoundly the foreign minister, the Indian leadership, the prime minister, and the Indian government for the support they provided to the Gambia. Because the most valuable resource we have is our human resources. And today, India has been helping us, and we have people in top echelon of government who have been trained to India. I myself have been to India several times, interacted with India. We both at the bilateral level and at the international level. I was permanent representative of the Gambia for 6 years in New York, and I was working hand in glove with the permanent representative. And I want to seize this opportunity to salute them and to wish them all the best. I know India is facing today a lot of challenges due to this COVID, but with all that they have been supportive of third world country, a very beautiful example of South-South cooperation.
Now, I was just looking at some of the economic numbers and what a third of the Gambia's GDP is reliant on tourism. And we know that the world has not really travelled anywhere over the past 18 months because of this crisis. Talk to me briefly, if you will, about the impact that that has had there, that lack of visitors to the country, and what are your hopes for getting international tourism back to appreciate some of what the Gambia has to offer?
It's terrible on the economy of the Gambia. I think over 150,000 people have lost their jobs in the Gambia because these are jobs related to tourism. And we know in Africa, when one person is working, he's taking care of more than at least 10 people. So it has been a disaster on the Gambia. But I mean, it's also an opportunity for us to buckle up and not only to depend on one sector. I think we should look at the opportunities offered by this sad situation and try to leverage on them, and also try as much as possible to be self-reliant. You know, the vulnerability of tourism. When Ebola struck West Africa, we did not even have a single case of Ebola in the Gambia, but we registered like 65% drop in our tourism industry. And today, it's a very sad and terrible situation. And government is trying to take measures to mitigate the situation.
And what will those measures look like? Where is the renewed focus?
Well, government, first we decided to help families with basic commodities, with little bit of money. But I think the emphasis is on us to be self-reliant, to be more and more self-reliant, to give a pride of place to agriculture in our development process.
And as far as welcoming tourists back, because of course that restructuring cannot happen overnight, how confident are you that you'll be able to get visitors back, at least in the short term, to help create those jobs that have been so badly affected?
Well, we are hopeful that with the vaccine and the possibility of people even trying to encourage some kind of medical tourism where we'll encourage people to come and get their vaccine here, we are hopeful that we'll be able to get some people coming, because I know still people are willing to come, but we are also afraid of encouraging people to come and have to deal with a situation that will be out of control. And that's why we are also being very vigilant. And for our control and managing of the spread of the virus, the United States Center for Disease Control, US CDC, has issued a level 1 travel health notice for the Gambia in its recent global risk assessment for COVID-19. And I think that shows it's been very, very challenging, very difficult for the population. You know, we live in community in our societies. It's been very challenging, but we have to deal with a situation where you have no other choice but to take some stringent measures.
Absolutely.
And we are hopeful that with the vaccine will have people who start coming back.
Yeah, and it seems that is absolutely the only way out of this. We wish you well. I'm so grateful for your time at India Global Forum. Thanks for joining us and talking us through that perspective from there in West Africa. Wonderful to see you, Dr. Mamadou Tangara there, joining us from the Gambia. Edie will be right back after a very short break. We're staying with the tourism theme. So special guest joining Edie in just a moment. Don't go anywhere.